The federal government has revealed plans of expanding access to the vaccines and decentralization of vaccine utilization in Nigeria by improving or involving the private sector in the vaccine administration. The Executive Director, Primary Healthcare Development Agency, Faisal Shuaib, who disclosed this while briefing journalists on Tuesday, said Nigeria will be receiving more doses of COVID-19 vaccines, and the private sector will be needed in the vaccine administration. KAFTAN TV correspondent Benedict tells us more on the story.
In the coming months, Nigeria will be receiving more doses of COVID-19 vaccines through the COVAX facility. In its efforts to utilize the expected large amount of the vaccine, the federal government has disclosed plans to implement the decentralization of vaccine utilization by involving the private sector in the vaccine administration. While briefing journalists on the update of the vaccine administration, the Executive Director, Primary Healthcare Development Agency, Faisal Shuaib, noted that private health facilities who meet the government-set criteria will be allocated COVID-19 vaccines.
In the coming months, Nigeria will be receiving more doses of COVID-19 vaccines through the COVAX facility. We anticipate that the vaccines will be quite large in amount and therefore will require more efficient and faster ways of utilizing them, including expanding access to the vaccines. We have therefore started implementing the decentralization of vaccine utilization by involving the private sector in the vaccine administration. Currently, COVID-19 vaccines are available at government health facilities only. As we decentralize, private health facilities who meet the set criteria will be allocated COVID-19 vaccines after due training of their immunization service providers. We are taking every precaution to ensure that with this implementation, the decentralization policy is not corrupted. Private healthcare facilities will be carefully selected based on transparent eligibility criteria, and supervision will be maximized to ensure discipline and compliance with safety measures.
Shuaib also noted that Nigeria is not among the red-listed countries that need mandatory quarantine for 14 days in a supervised UK facility.
So it's just a question of time before Nigerians will now be able to go to the UK and not be required to isolate for 10 days. Some of these protocols are being reviewed at the Presidential Steering Committee, but the key message here is Nigeria is not on the red list, and the processes that are being done to review vaccination certification are ongoing. They are being done in phases. There's a close collaboration between us and the UK government, and we are optimistic that Nigeria will be approved when Nigeria is assessed. So first, we need to get assessed, then we can get approved.
The country representative of WHO and UNICEF representative also reiterated their commitment and partnership.
I also would like to reiterate that WHO does not mandate COVID-19 vaccination as a criteria to enter any country.
It's important also that to note that the cold chain is being continuously monitored in all the states to ensure that there's no breakdown in the cold chain and the vaccines reach the targeted population in a safe manner.
As of the 4th of October 2021, Nigeria has vaccinated 4.4% eligible persons with the first dose of COVID-19 vaccines, about 2,166,186 with second doses of the vaccines, which amount to 1.9% of eligible individuals vaccinated against COVID-19.